Howdy, I'm Yen,
And I'm Litzy.
and welcome to Yen and Litzy Sustainability Talks.
This is the third video in our series about environmental justice, and today's topic is health impacts. The presence of big factories have huge impacts on community health. Many people located near these factories are forced to endure large amounts of pollution without even knowing it. The main population to be located there are minorities, low income, and indigenous populations. These populations bear a disproportionate burden of environmental harms and adverse health outcomes.
Have a small population, it has an outsized reputation for having one of the highest risks of cancer in the nation.
Well, I lost my mother to this. My wife is a cancer survivor. I lost nephews, uncles, neighbors. I don't think anybody's life is worth a job.
Reserve lies in the heart of what's called Cancer Alley. It's a corridor 85 miles long in between New Orleans and Baton Rouge, dominated by more than 150 chemical plants.
In Indonesia, one of the biggest coal-fired power plants was restored to full capacity. The area of about 30 million people was choking on smog. Jakarta, one of the cities in Indonesia, has been battling worsening air quality for years. It has been topped global population rankings several times last year.
The sky above Jakarta has turned a bleak, dusty grey. A thick haze blankets the city, and residents are choking in the smog.
Breathing is difficult. My eyes hurt. I have to use eye drops when I get home.
Jakarta consistently ranks among the most polluted cities in the world. It often records unhealthy levels of fine particulate matter. But in recent weeks, air quality has been particularly poor. Environmental groups say years of inaction by Indonesian authorities is endangering the lives of 30 million residents who live in Jakarta and surrounding areas. Data from health centers in South Jakarta indicates a more than 20% increase in patients with acute respiratory infections.
Next, we're going to discuss pollution. Environmental factors such as air and water quality are fundamental determinants of our health and well-being. Environmental factors can lead to disease and health disparities when the places where people live, work, learn, and play are burdened by social inequalities. According to a 2019 study published by the National Academy of Sciences, African Americans are exposed to 56% more pollution than they are actually produce. Meanwhile, white Americans are exposed to 70% less pollution than they produce. African Americans are also 75% more likely to live near industrial facilities than white Americans. On the other hand, Palestine is one of many countries most vulnerable to climate change, despite its negligible contribution to global emissions. In 2019, sewage infiltrated Gaza's aquifer and resulted in it entering into Gaza's coastal water untreated, damaging marine life and health. 97% of Gaza's scarce water is now unfit for human consumption, and contaminated water causes 26% of all illnesses in Gaza and is a leading cause of child deaths.
The most severe health impact of climate change is death. Extreme heat kills more people each year in the US than any other kind of natural disaster. Globally, its impacts are enormous. During historic heat waves like 1995 in Chicago or 2003 in Europe, or 2019 in France, thousands of people can die at once, and many suffer severe health impacts that can last long after the heat dissipates.
A new report from UNICEF says 76% of children in South Asia are exposed to extremely high temperatures, the highest percentage in the world. It means children in the region, which includes countries like India, Pakistan, Afghanistan, and Bangladesh, are living under extremely high temperatures 83 or more days a year. The report emphasizes how these children are bearing the brunt of climate change.
Throughout the series, we've already addressed the likelihood of third world countries bearing the brunt of climate change. However, how does environmental injustice manifest itself here in the first world?
The last 8 years have been the hottest years ever measured on the planet. July was the hottest month ever recorded. July 6 was the hottest day. All over the planet, the heat broke temperature records, including in Siberia, 103 degrees. More than half the U.S. population was subject to heat warnings in July. Here in Phoenix, Arizona, The heat has broken all kinds of records, including the longest streak of consecutive days where the temperature hit 110 degrees or hotter.
Really cooking today in Phoenix, 118 degrees. I think tomorrow will be even hotter.
In many areas that are low wealth, those communities may not have trees. Those communities may have older buildings, so they may not have air conditioning. And those communities may have a lot of concrete, a lot of asphalt. One tree can bring the temperature down 20 to 25 degrees. So you can see a 20 to 25 degree difference between one tree in front of one house compared to the next house that didn't have a tree.
Okay guys, the code word for this video is cancer. Of course, even in the US, communities of color are more likely to climate-related health impacts. However, as time progresses, the more likely communities of all demographics are falling victim to climate change.
Portland, Oregon reached upward of 116 degrees Fahrenheit. It's been estimated that there were over 600 excess heat-related deaths in Washington and Oregon alone in 1 week. Extreme heat can cause damage to the brain, worsen mental health impacts. It can affect heart and lung disease, kidney disease.
And the list goes on. Climate change kills. A study found that on average, more than 1 in 3 heat-related deaths can be pinned on climate change. But in some South American countries like Kuwait, Iran, and parts of Southeast Asia, the human toll is much higher, as much as 77% in Ecuador or 71% in Philippines. Some factors of our health that are affected by climate change are air quality, food and water security, disease, extreme heat and weather, and social impacts. And between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress alone. Okay, that's all we got for y'all today. Thank you so much for watching our video.
And as previously mentioned, it is important that we talk about these topics and that we also bring awareness to them.
Okay, that's it. Bye. See y'all later.